Between the New York State border and Hartford, we have one of the most capable advanced robotic surgery programs in the state. Robotic surgery is essentially the technique of the future. The foundation has just been fantastic with getting the money together to purchase these for us. 20 or so years ago, we did all of our surgeries with open incisions. We then progressed to doing minimally invasive surgery. Some people call it keyhole surgery. And now the next step is robotic surgery. The advantages over traditional laparoscopic surgery is that now the surgeon can see in magnified three-dimensional vision. And the instruments that we use are double jointed, almost as if they give us twice the range of motion that a human hand does. The Da Vinci robots that we have here are designed for intra-abdominal and chest surgery. Any surgery that can be done in the abdomen can be done robotically. Lots and lots of safety features that are built into it. Everything absolutely has to move in sync. If we move just a little bit too quickly, it sort of controls that movement. A lot of people tend to get nervous when they hear something like robotic surgery. They think that the robot is what's doing the surgery. The surgeon is still doing the surgery. When you add all that together, the length of stay is reduced and it's a better patient experience. Another frontier that is happening in the world of medicine is three-dimensional printing. For decades, we've had to use some sort of tricks to make up for that lack of third dimension. We would sort of have to go in the operating room with a lot of guessing. Now with the three-dimensional printer, we have that model in our hands when we go into the operating room. We've been able to print out kidneys with the tumor in the kidney, and our urologists will literally take this into the operating room with them to map out their surgery. I'd really like to thank St. Mary's Hospital Foundation and all of the donors for helping us build this robotic program. And I sort of hope to be able to put us into a position where St. Mary's and Trinity Health of New England leads Trinity National in their endeavors to do three-dimensional surgery throughout the country.